The first year of a child's life is filled with firsts and surprises for both the infant and their families. The child is exploring their world through touch and smell and forming an everlasting bond with their caregiver. With all this excitement, we often forget that the first year of life is also one of the most critical years for survival. Although advancements have been made in an effort to decrease infant mortality, it's still very much an issue today. According to the Center for Disease Control, 23,215 babies in the U.S. will die before their first birthday. Ohio is among one of the worst states in the nation for infant mortality. In 2010, Ohio had the fourth highest infant mortality rate in the U.S. To make matters even worse, major health disparities exist within these infant mortality rates. Black infants are twice as likely as white infants to die in their first year of life. In 2012, approximately 14 babies died for every 1,000 live births. There are countless reasons why infants die in their first year. However, premature births, low birth weight, and sudden unexpected infant death syndrome tend to be the most dominating factors in infant mortality rates. But what do these factors have to do with race, and why are they so significant in Ohio? One study from the Kirwan Institute at Ohio State uses a socio-ecological model in an attempt to understand how disparities impact infant mortality rates in Ohio. The model breaks infant mortality into 5 levels: the individual level, including the infant and the mother; the interpersonal level, which looks at the family structure; the organizational level, which evaluates healthcare, education, and employment; the community level; and finally, public policy. At each level, the study provides recommendations to help decrease infant mortality. Let's walk through an example together. A young African American woman gets pregnant. We'll say her name is Tara. Tara lives in a low-income neighborhood in Columbus. She experiences stress throughout her pregnancy, determining how, as a single mother, she will provide for her infant. Stress can be a factor in low birth weight as well as preterm babies. Once Tara's baby arrives, she begins to smoke again because of the stress. And she doesn't have the means or ability to breastfeed after she brings her infant home. In addition to this, a crib was much too expensive, so the infant sleeps in bed with Tara the majority of the time. Before the baby turns 1, he dies of SIDS. Tara's story is not uncommon. The study states that smoking, discontinuing breastfeeding, unsafe sleep practices, being a single parent in a low-income neighborhood, and being African American are all risk factors that contribute to infant mortality. From the outside looking in, it's easy to say, don't smoke and place your baby on their back in their crib. However, in Tara's situation, we can see that it's not quite that easy. Infant mortality is a major public health issue that we need to put a stop to, and it's going to take much more than making easy suggestions that are often unattainable for the populations that are being addressed. The Baby Box program is one initiative that has made it to the U.S. from Finland, who happens to have the lowest infant mortality rate in the world. The Baby Box is a cardboard box with a firm-fitted mattress that the baby can sleep on. In New Jersey, new moms watched a 20-minute educational video before being sent home from the hospital with a free baby box filled with supplies they would need for their infant in the first year. Maybe it's time for public health to start thinking in the box. We need to understand what the individual's needs are in order to address ways to fix them. Then we can address simple ways in which public health can help at-risk populations decrease their infant mortality rates.